Inguinal hernia.
Inguinal hernia. It is the abdominal protrusion of abdominal content such as intestine through an area of weakness in a groin muscles. The protruding intestine resides in what is known as hernia sac. In some cases, untreated hernia cause complications. For example, if part of intestine becomes stuck in the hernia opening, its blood supply may be cut off, leading to the death of the intestinal tissue. This is called strangulated hernia. Actually, there are two techniques, traditional and second one is newer laparoscopic technique. Now traditional open inguinal hernia repair requires a relative large single incision as you can see in the image. Now new laparoscopic technique, it requires a tiny keyhole incisor or puncture wounds which generally result in a shorter recovery periods. Procedure, general anesthesia, breathing tube, catheter placed in the bladder.
There are two types of surgical approaches. First one, extraperitoneal laparoscopic repair. Second one is transabdominal preperitoneal repair.
For the incision, we will use a sharp instrument called trocars to create 3 small holes or ports through abdominal wall. Location of these ports will vary depending on surgeon's preference and the type of procedure. One of these ports is usually located at navel or umbilicus. Carbon dioxide gas will be pumped through umbilical port to puff up the abdomen to see its content more easily. Now we will insert laparoscope through the umbilical port. Images of its camera are projected onto video monitor in the operating room. We will pass various instruments through other ports. These will be used to dissect away the hernia sac and to take a piece of mesh over the hernia opening to prevent the intestine from slipping back through the opening. Before removing laparoscope, we will take one final look around the area of bleeding or other damages. Port valve is briefly left in the place to allow all carbon dioxide to escape from the abdomen. Finally, keyhole incisors are closed with suture or staples and covered with the bandages.
After the procedure, breathing tube is removed, catheter is also removed. We will take patient in the monitored recovery room. Pain medication is also given to the patient. Intravenous line is removed. Patient is removed from hospital within 3 to 4 days.